Yo, I just climbed out a hole that was so deep. Have you ever seen a rose grow from a concrete?
Entering into my second phase of chemotherapy, I completed my 4 rounds of doxorubicin, and now it's on to Taxol. Taxol. This is the one that actually gave me all of the issues. And it's crazy because my oncologist was stating that most people have the most difficulty with doxorubicin and less issues with Taxol. I would have chemo with other breast cancer patients that were also doing Taxol. They felt the same way. Well, I was completely the opposite. Taxol gave me so many horrible side effects, and the number one worst side effect of them all was neuropathy. Neuropathy, for those of you who do not know, is basically numbness that's in your hands and in your feet. It might sound like it's not that much of a difficult side effect to deal with, but believe me, it is. Imagine having a brain freeze that lasts 24/7, all day and all night. Nothing you can do that will get rid of this brain freeze, and that is how it felt for me. And I could not complete all 12 rounds of Taxol. My oncologist decided to stop at the 9 rounds because about that time is when I felt the neuropathy at its peak. I couldn't do simple things like trying to get my daughters out of their car seat. I could not press that little red button down to open up the car seat. And at that point, I realized this is bad. And I would walk on my feet, on my heel basically, and it was horrible. He did, before it got to that point, he did prescribe me with gabapentin. I did not want to start a new drug. For one, how would I know if the neuropathy is going to be temporary or permanent, or if it's going to get better if I'm on a drug that is supposed to be assisting with it? I then looked to all types of unconventional ways to try to improve it. When I started feeling the symptoms of neuropathy, I began to wear compression stockings. They were a huge help, especially at night. The muscle cramps got worse, the neuropathy in my feet got worse at night. So I would wear the compression stockings throughout the night. Many things unconventional. I went to reflexology. I went to receive acupuncture. I was doing the most, but I did deep dive in research into foods that could assist me with neuropathy, and that made me create a post-chemo diet guide, which also would help, of course, during chemo. But my goal was to assist myself as I got off of chemotherapy. So on Taxol, I had diarrhea, which is something, you can kind of work through and take certain medications to prevent it. And then, when you're trying to prevent it, it makes you constipated. So then you have to take other medications to release the constipation. But my body would tend to, since I was going in weekly, the first 1 or 2 days I would have the issue, and then by the time it's really time for me to come back for the next round is when I would not have that side effect anymore. I also had pain in my joints. Really, I could feel it, not really so much pain, but my knees. No more making knees for me. Much of the side effects that I had on doxorubicin also came over into my phases of Taxol, including the discoloration of my nail beds and the hair loss. So my hair was not able to start to grow back. during Taxol, because that is a prominent side effect, is hair loss and the changing of the nail beds as well. As I started Taxol, I also started the target therapies for the HER2 receptor, which are Herceptin and Perjeta. Now, I couldn't tell you whether or not these side effects that I had were due to being on Herceptin and Perjeta or Taxol, because they all had the same similar side effects. Fatigue, like I said earlier, was an ongoing side effect that I experienced throughout all of my treatments. The side effects such as weakness, fatigue, and body pain, I experienced those, but like I said, I don't know which drug to pinpoint to blame it on. If you did not have to take Taxol, but you do have to take Herceptin and Perjeta, then these side effects are commonly known with those drugs. They're not as big of hard hitters as the Taxol. Also, when I stopped the Taxol, maybe less than a month after that, and I was still on Herceptin and Perjeta, my hair did start to grow back. Herceptin and Perjeta are also known for causing heart disease, which is why my oncologist has a echocardiogram scheduled for me every 3 months. You definitely want to monitor your heart, maybe get a cardiologist if you do have any types of issues. I will say that I did have anxiety maybe about 2 years ago, and that included panic attacks. During the time that I was first diagnosed with breast cancer, I could tell that my heart rate was being a little irregular. It would beat approximately the average of 110 beats per minute, and I would just be sitting down doing no type of rigorous activities, maybe just watching TV, and my heart will be beating at 110, 120. Sometimes it would even get up to 130 heartbeats per minute. And I informed my oncologist about that. He recommended for me to see a cardiologist that wanted to put me on another drug. And I declined getting on it at first and wanted to go back to doing some normal activities, such as exercising, which I have only done so little with that so far. That is one of my goals, is to definitely get back into the gym, but I'm a little bit hesitant on doing that just because of COVID, and people don't have to wear a mask anymore. People do not have to wear gloves anymore, and I'm already a little bit of OCD, so I don't know how that's going to work out. But I'm not a person that likes to work out at home. I can do the treadmill for 20-30 minutes tops, but anything other than that, I just can't get with it. I know my weaknesses, and that is one.